Newborns can have a lot of skin issues. I'm going to talk about some of the most common normal newborn skin conditions that you might see after you bring your baby home from the hospital. The first newborn skin condition that I want to talk about is baby acne. Yes, your newborn baby can get pimples. Newborn acne or baby acne tends to look really just like a pimple, except maybe a smaller version. It's usually kind of in the T zone, forehead, cheeks, nose, maybe some chin. You don't want to pop baby acne. Leave it alone. This is something that just kind of pops up randomly. Normal cleansing in the bathtub with a clean washcloth with just water, or if you choose a mild baby soap every couple of days, you want to skip days in between soap, will usually help this condition to clear up on its own in the first few weeks, maybe a month or so. The name for this condition is really dramatic. The nicer term that you might hear used is called newborn rash. And basically, this is a skin condition that lots of newborns have in the first few days of life, especially while you're in the hospital. We always have parents call us to the room to say, "What's going on? My baby has hives all over them." It can look a lot scarier than it is. It can appear in those first few days or even a few weeks after birth. It's a normal skin condition. Newborn rash is similar in appearance to hives, but kind of more like a bumpy appearance, almost like a mix of hives and baby acne. And it comes and goes, which is one of the key characteristics of Erythema toxicum. It'll show up and you'll start freaking out. What's going on? Was it the laundry detergent? Is it something in my milk? Usually it just comes and goes on its own. Even if you've been holding your baby for too long, you might see some newborn rash appear on the face, the chest, the arms, and then a few hours later or a day later, it will be gone. So again, newborn rash is nothing to worry about. Also, with newborn rash, there's really nothing you can do because, like I said, it comes and goes. You can try to put something mild like Aquaphor on your baby's skin after you take a bath. This helps with a lot of skin conditions, just a mild emollient that's going to help to keep the skin moisturized, because the number one thing you want to know about your newborn skin is it can be very, very dry. It's very susceptible to dryness, and that can lead to a lot of other issues down the road. So you want to keep that skin as moisturized as you can, especially after bath time. Mongolian spots. This one is super confusing for parents because it looks like your baby was in a fight or something. You'll most commonly see Mongolian spots at the base of your baby's spine, on their back, in the sacral area, and it kind of goes across. And you'll see in this picture, but it looks like bruises in many cases. On darker skinned babies, it has more of like a grayish appearance. But in either case, lighter skinned or darker skinned babies, it does have kind of a bruised appearance. Problem with Mongolian spots is that if your healthcare provider is not trained to recognize Mongolian spots, sometimes this can be confused for child abuse. And there have been cases where providers believe that the parent was abusing their child because they saw these bruises across their body, when in fact it's just a normal newborn skin condition that comes and goes. It goes away over time, and these are most commonly seen in African American or Asian babies. So that is something to be aware of. If you see this, you didn't do anything to cause it. It will go away on its own. Stork bites. The official name for this is nevus simplex. These are temporary birthmarks that are flat and pink, and you'll find them most commonly in the forehead area or sometimes the base of the neck. They can be in other places as well, but sometimes those two areas are the most common. You might notice this showing up right after birth. And actually, a fun fact, the stork bites can darken if your baby is crying. These little birthmarks are caused by the stretching of blood vessels, and they tend to fade over the first year of life. The next condition is called milia. These are actually tiny white dots. They look like little whiteheads or blocked pores on your baby's face, most commonly seen around the nose area under the eyes. Once again, just like baby acne, you do not want to pop these bumps. That can lead to a severe infection. We don't want to mess with them. They will go away on their own. There's no treatment for this condition. Another type of birthmark is called cafe au lait spots. These are kind of similar to Mongolian spots in a way because they're more of like a darkening of the skin, but you'll find them in different places. They are a brown flat spot. Usually the most common size I would say is about like this, and you'll see it on the trunk, on the back. They can really be anywhere. And these are a more permanent type of birthmark. It's just a darkening of the skin pigment. And again, nothing to worry about. There is another type of birthmark that is called a port wine stain. A port wine stain, the medical term for this is nevus flammeus. This is another permanent type of birthmark that starts out a little bit of a lighter pink color and it tends to deepen in color over time, becoming more of a purple as the child grows. There is the option that some parents do choose to do, which is laser therapy to help this disappear. And that is typically chosen if it's a real cosmetic issue, if you have a very large area that's covered, or if it's bothersome to the child in any way as they get older. The last type of skin condition is a hemangioma. This type of birthmark is a collection of blood vessels and it can actually appear raised on the skin. Sometimes they'll be very, very small and it will not be bothersome at all. There are more rare cases where the hemangioma is very large. Sometimes you'll see them in the back of the head and they can vary in size. Typically, a hemangioma does fade over time as your child gets older. So there you have it. Those are the most common types of newborn skin conditions that you might see in those early days to weeks of life with your baby. They can look a lot scarier than they really are. So hopefully this video will bring you some peace of mind and now you know the answers to what's going on with your baby's skin. I hope you like this video. Please like and subscribe and stay tuned for more content like this to help you through everything pregnancy, birth, postpartum, and baby care with Nurse Carly.